Good day, everyone. Today we are discussing prostate cancer. This is one of the most common cancers affecting men, especially as they grow older. Hello, good afternoon, everyone. The podcast you just saw now is the Waveform podcast format. So we are going to dive into how to generate it for ourselves, for the audience. Thank you very much. Waveform podcast and audiogram. So today we'll start with the Waveform podcast. We've seen the demo video of the waveform, and also we shall be replicating those two again. So now, how do we create the first podcast, which is the Waveform podcast? This is a workflow you follow. Number one is you open your CapCut. After opening your CapCut, add your cover, which is the background media. Then after, you add your audio. Then after, you go to your effects. When you are at effects, you search for your audio spectrum and you click add a waveform. You will see several lists of waveform. Click on the ones you want, just one you want, because if you click more than one, it will increase the volume of the megabyte of the aftermath effect of your video, of your podcast. So we just pick one, and that after adding a waveform, you adjust the position, the style, and you export the full video. Now let's go to work. So you click on your CapCut. Your CapCut will bring you to this interface, and the next you're gonna do is click your new video. After clicking your new video, just go to your photos. We want to add so just pick an applicable cover, and so you can pick this. So this has been picked. Click your add. After adding, the next to do is we've added a background, which is a cover. Let's add our audio. So you've seen this area of add audio. So press your plus add audio. You go to your sound, and the next thing you do is you can go to your go to your folder. This is a folder logo. From folder, go to your device, and from device, let's search on our audio. I have diabetes podcast. I also have breast cancer. So let's search for the first one we're going to see. So breast cancer or diabetes. Okay. Breast cancer. Okay, it's not here. Perhaps we're going to pick another one. If it's gonna pick prostate cancer, you click your plus, you add. After adding, the next thing you do, please pay rapt attention. The next thing you do after adding your audio is go to your effects. To see your effect here is not here in this list. So what do? Press this arrow, this double arrow. Press once. Good. So with this single arrow, you see anything you are looking for. So we are looking for effects. So what are you going to see? Just let's press the effect. Let's press the arrow again. Good. Can you see the effect? Press the effect. Now the effect will take us to somewhere. Can you see what it brought? Now let's click on our video effect. Then we are going to search for what? Our audio spectrum. So let's search for audio spectrum. Audio spectrum. You may not see it, but you see something similar. So search for audio spectrum. Good. So can you see your audio spectrums? Then you pick the ones you want. Which one do you want? Make sure you don't pick a paying tool. Pick a free tool. The paying tool does not has diamond, but the free tool does not have diamond. So let's pick one that we want. Let's pick this. It doesn't have any diamond, so we're not going to pay on subscribe. So can you see it has been downloaded? So you can press to adjust. Good day everyone. Press to adjust. Can you see? So you can, this is the speed. You can adjust the speed. Let's change the speed to be moving very fast. So having done that, good day everyone. Click. We're through with that. The next thing we're going to search for is add waveform. Press your waveform again. Delete this and press your waveform. Good. Search for your waveform. Then it's going to bring you some. Yes. So this is only two we're going to do. Which waveform do you want? If it is me, I prefer this. So you can pick this. Is okay. It does is a free tool. Good day everyone. So what do? You press the adjust. What do? There are two to adjust the speed and the atmosphere. The atmosphere has been increased to the maximum. You can increase the speed too. Let's increase it to almost maximum. But then with this, good day everyone, you press your arrow that you're through. Then we're through with the effect waveform. Then the next thing is we go to the position and style. Then we can see the position here. Let's click our cancel. Let's go to position. Click your arrow. This right means you want to activate what you've picked. So you pick your arrow, then it has been added. Can you see? Now the next thing you do is click this arrow. Now we are going to adjust. So we look for position so we can adjust the position. So can you see adjust here? So go to your adjust. That's the third thing to do. You click your adjust. And what do? Can you see what to adjust here? You can adjust the color match. You can adjust the contrast. You can adjust. Can you see the contrast here? You can adjust the saturation. You can adjust the brilliance to make it more brilliant. So this is it. You can adjust the clarity. You can adjust the HSL. So let's try adjusting the shadows. Okay, let's try adjusting the temperature. Okay, you can increase it here like this with true. Then let's click your OK. That's it. So we're through with adjusting. We are through with adjusting the style. The next thing is we're about exporting. So before we export, let us update the audio. I'm not sure, have we picked any audio? Okay, let's click it so to see, because I can't see any audio here. I don't think we've picked any audio. So let's go and pick the audio. Click your edge now. Okay, that's the audio. Now the next thing you do, you drag each of the media, which is the cover. You drag what you just adjusted, the position you adjusted, and also the waveform you added. You are going to drag it to reach the same limit with the podcast. So what do we do now? Now let's first start with the cover. And the cover, at this point we may have to change the cover because we are talking about prostate cancer. So what do we do now? Let us change the cover here. Let me reduce it. Let me add the prostate cancer. Let me add something that talks about, let's use what we've seen as good. So what do we do now? We drag it. Can you see the prostate cancer? Let's drag this particular item. Let's drag it so it will be the same limit. Click on what you want to drag. We are drag the label so to the same point of the podcast. So when the podcast is ending, the media too will be ending, to show you are professional. Good. Now let's go again and drag the other items, which is a waveform. Now there's no text. We are dragging the words. This is a waveform. Let's keep dragging it to reach the same side and limit of the podcast. So you keep dragging, so one won't finish before another. Good. Now the next thing, let's go and drag the audio spectrum. We've dragged the waveform. Now let's drag the audio waveform. The audio. Okay, we've drawn the. Now let's drag the audio spectrum. Now let's keep dragging again. You click on it to drag. Good, we drag it. Now let's go to the next one. You drag all, so they'll all end at the same time. So let's click the interface again, the screen again, and let's see the one we've not dragged. Can you see? I think we've dragged both all. So what do? We can just play. Let's play before we export to see any error. Good day, everyone. Let's increase the volume. Click on the podcast and increase the volume to the maximum, so it will be very loud. Can you see? Now, good day, everyone. Loud. The next thing we'll do is let's add some background volumes. So you click OK to activate it. Let's add some background volumes, so it will make our work look professional and engage the audience. Now to do that, press this arrow. Press it again. Now let's go to what audio. Add some background audio. Go to your sound. I've downloaded some uncopyrighted versions of audio. So let's go to your folder. Go to your device. It means you are looking for those you downloaded. So let's keep looking. Let's search for copyright. It will give us uncopyrighted audios. Copyrights. Good. Let's search for it to bring several copies. Okay, can you see them? So these let's try picking this for time. This is great. So as you are picking it, reduce the volume because it must not conflict with your podcast. The audio we just pick is just meant to give a background, not the main voice. So you reduce the volume, press the volume, take it to like, let's say 15. 15 is okay. If you take it to 20, it may be conflicting with the main. Good day, everyone. Today we are discussing prostate cancer. This is one of the most common cancers affecting men, especially. The thing you do is this: how it will be looking. This will keep engaging your audience. The next thing you do on the final thing before we export is you are going to now take off the watermark of CapCut, so it won't look. Now take off the watermark. Can you see? You can press or delete. Anything highlighted is when you press delete, it will take it off. So make sure this is highlighted. This is what we want to delete. Delete it. So that is the watermark. At this point, we don't need to view our demo again. Just export it. Is well done. You see? So to export, if you've done it well, let me export. Let me stop my video now because of time, and so it won't. This is what we've recorded so far. Good day, everyone. Today we are discussing prostate cancer. This is one of the most common cancers affecting men, especially as they grow older. You should understand its causes, the symptoms, and how it is diagnosed, and the available treatment options. What is prostate cancer? It is a malignant growth arising from the prostate gland, a small gland in men responsible for producing seminal fluid. Who is at risk? Number one is age factor contributes to being vulnerable to the risk. When you are above 50, one is vulnerable to having it. Family history makes one to be vulnerable, because if it flows in your family, one may be likely to having it. And also again, it can be in their African ancestry. If it is found in the lineage, one may be vulnerable. And also again, hormonal factors especially makes one to be vulnerable. So older men, particularly African men are at higher risk if it is found in one's lineage. Now let me make this simple. Normal prostate cells begin to grow uncontrollably due to genetic mutations. Over time, these abnormal cells form a tumor which can spread to nearby tissues or even bones if not treated. Early stages may have no symptoms, which makes screening very important. Later, symptoms include difficulty in urinating, weak urine stream, frequent urination, especially at night, blood in urine or semen, bone pain, particularly in advanced stages, and also again, as the prostate enlarges, it compresses the urethra. This is why patients have difficulty passing urines. How do we diagnose? Diagnosis involves PSA test, which is prostate specific antigen, digital rectal examination, DRE, biopsy to confirm cancer. How do we treat? Treatment depends on the stage. For early cases, you may use active surveillance. For prostatectomy, you can use surgery. Radiotherapy, you can use radiotherapy. You can use hormonal therapy. You can also use, for advanced cases, chemotherapy. And again, is better. There's nothing that is guaranteed when it is early detected, because early detection saves lives. Men above 50 or earlier, if at risk, should go for regular screening. In summary, prostate cancer is common in older men, often silent early. It affects urination as it progresses. Early detection is key. So when you see an older man with urinary symptoms, always think and go for your screening on time, so you can detect it on time and arrest it very early. Thank you and stay blessed.